Okay, so how'd you find out about us? A friend. When I was in high school, I had a friend who sprained his ankle. And I remember him, oh, it was bad, you know, it swelled up and turned black and blue and all. And then he recovered from that and he was fine, and a few months later he sprained it again. And so then they referred him to an orthopedic surgeon. And I remember him coming back to school and he said, doctor says I'm always gonna have a weak ankle. You know, you stretch these ligaments out and they don't ever rebuild, they don't tighten up. And so he said, you know, if I play sports, I'm gonna have to wear high top shoes or wear a, you know, wrap my ankle when I play, or wear an ankle brace, and there's, you know, and then he did physical therapy trying to strengthen the muscles around the ankle and the tendons that go across it to try to compensate for that. And but otherwise, you know, if it was a big rupture of the ligament or it completely tore off the bone, then maybe he'd consider surgery. But since it was just stretched out, he didn't really have an option. If he got bad enough, then he could think about surgery, but those were the only options. And so I learned at a young age that you can't get this white fibrous tissue to heal very well because it doesn't have good blood supply. What we do now is we just treat these things with medicines to treat the inflammation. So you sprain your ankle, it swells up. Well, that's bad. You don't want it swelling, right? So you take anti-inflammatory medicines, or you ice it, or inject a steroid in it or around it to calm the inflammation down. And people correlate pain with inflammation. When I was in med school, one of our first classes is pathology. And one of the first chapters is on inflammation. And inflammation really is one word that covers a huge topic. There are all kinds of chemical signals that happen with inflammation. There are cells that are recruited to come to the area to start building things. There's new blood vessels, little capillaries that will grow in to try to repair things. And one of the first quotes I remember reading was that inflammation is how the body reconstitutes and repairs damaged tissue. And my first thought was, I wonder why we always anti-inflame everything. And you know, I'd never seen anybody say, yeah, let's inflame this so it'll heal. But that's basically what prolotherapy is. What we want is not a lot of the pain associated with the inflammation, but all those growth factors, those chemical signals, and then the blood flow that comes in to heal it.